everyone, and welcome to our roundtable today. My name is Josh Dance. I am one of the directors and SVP with LSX, organisers of the Healthspan Show. Thanks for joining us today. A few points of note, which I will put in the chat as well. There's going to be people who are sort of filtering through latecomers. And yeah, just a few points to note for the running of today's roundtable that make things run a lot more smoothly. Firstly, we do want this roundtable to be as interactive as possible. We'd like you to be jumping in, asking your questions and comments. Our panel here have a lot of things to go on, a lot of things they want to discuss and bring up. But we do want you guys, as the participants, to also, have your say and be able to ask your questions to the panel. So we would encourage everyone to have their cameras on if at all possible. It helps in sort of building that interaction with everyone who's here. When you do have a comment or question that you would like to make, what we'd like to recommend is that you put that comment or question in the chat. And then at the right point in the conversation, Kenny, as our moderator, will invite you to unmute and then ask your question or say your piece or whatever you'd like to mention in the roundtable, and live via the sort of whilst on video and on camera. If for any reason you really don't want to sort of be on camera or not want to sort of say your piece verbally, we can just answer the questions on the chat. But as I said, to encourage that sort of interaction on the roundtable, we would prefer if everyone could have their camera on and sort of ask those questions live in the chat function. I'll keep some reminders going in the chat function as well on timing to make sure that we can stick to time in the hours that we have, and I'll be continuing to admit people throughout. But for now, I'll hand you over to our expert panel and indeed our moderator for now, Kenny. So Kenny, the stage is yours.
Thanks, Josh. Afternoon, evening, or maybe morning, depending on where you guys are coming in from. My name's Kenny Butler. I'm the strategic lead for health and wellbeing at ukactive, which is an organization that represents the fitness and leisure industry in the UK. Today, we'd like to be talking about, and hopefully in the right place, talking about putting lifestyle at the healthcare front line, examining social prescribing, touching on rehab, chronic disease management, and prevention. If the pandemic has showed us one thing, that's the importance of a healthy lifestyle and preventative health measures. So social prescribing, which had much momentum prior to the pandemic as globally, but as we emerge from the crisis is even more important to businesses and industry as well to interact with that, to respond for the need that the social prescribing is showing, to benefit healthcare systems and the individual, of course, to give them choice and control of what they need for their health. So this is about that person's choice and control, and what things they can do for their lifestyle. So in other words, how do we put lifestyle in front to be more active, but not just physically, socially, and emotionally as well. Pretty excited about this today. The topic represents a personal and professional passion of mine. I've been preaching to the fitness and leisure sector, for instance, how it can be part of the social prescribing pathway. And, there is suppliers and other people and physical activity experts like Exi, for instance, to support that healthcare as well. But enough about me, enough about that. I would like to introduce Grace and Nick. And I think they'll do a much better job if I pass over to them. So Grace, can I start with you to introduce yourself, please?
Yeah, sure. Lovely to talk to you again, Kenny, and welcome everyone. So yeah, ultimately, I am currently CEO of a health tech company called Exi. My background is fitness physiology, epidemiology. So I've spent my entire life trying to get people to move, to be honest with you, and to change their lifestyles around health and healthy behaviors with the purpose of prevention is always better than cure. I've been lucky enough to work in the tech world for give or take 13 years now. And I've always been driving technology as part of that solution and part of that journey. So working with clinicians, fitness professionals, and health professionals from across the spectrum. So yes, I'm delighted to be here talking about social prescribing, which is the future. I think in partnership, hopefully we can truly move the needle towards people being healthy and self-care for the greater good. So yeah, over to you, Nicola.
Hi everyone, lovely to be here this afternoon. Looking forward to the next hour. My name's Nicola Gitsham. I'm the head of social prescribing at NHS England. Really fantastic to be here. I'm an occupational therapist by background, so I absolutely have felt my whole career how important it is to take a holistic view when we're trying to support people around health and well-being and look at solutions other than medicine to help people really be as healthy and as well as they can be from their mental and physical health, but also to find their purpose, their sense of agency over their life and connection and meaning. So that's really at the heart of social prescribing and personalised care as well. So I lead the programme at NHS England. We can talk a little bit more about that this afternoon and about how social prescribing is working with the fitness and leisure industry across the country. So really looking forward to today's session. My background, as well as being an OT, is I've led a number of cross-government pieces of work around the personalisation of public services across social care, education and health. So it's just great to be here.
Amazing, thanks both. So today, I'd like to kick this off. So today, we're going to talk around 3 themes, but please, you all butt in with some questions if you want to ask questions as we go along. I'll stop and try to answer those and get the guys to answer those as well. But one, we're just going to talk briefly about the current state of affairs. You can't ignore it. We'll just talk about what's going on right now from Grace's and Nick's perspective. 2, we'd like to go into detail about social prescribing and maybe look at a bit about the rehab and look at long-term conditions and prevention around that. But thirdly, and I'd like to spend much more time on this, around the solutions, because we want to talk about what we can do as far as helping social prescribing pathway. So to kick it off, let's kick it off with about the current state of affairs. So, you know, as I said, never before have we been so aware of our health and how our weight and lifestyle can make us susceptible to ill health. The NHS and in the UK, and I'm sure they're doing things globally as well for other health systems, are setting out long-term plans around ambitions to support people to live longer, especially around prevention and better lifestyle choices. So one big aspect of healthy living is activity, you know, and as I said, it's physical, social, or emotional, being more active. Let's start, you know, with Nick, to tell us a little bit about the current state of affairs. And that's a pretty broad statement, I suppose, with the NHS from your perspective, and maybe look at the personalized care, some of the priorities and areas that you've seen, increasing complex problems, etc. Perhaps inequalities as well that you've seen increase in your area.
Yeah, brilliant, Kenny. Okay, so obviously, you know, we all know the NHS has a really key role and does a fantastic job of that at supporting the health and well-being of the nation, and probably that's become more apparent over the last year, and people's awareness and appreciation of that is greater than ever. But obviously for the last year and a bit, we've all lived through a pandemic and continue to live through this pandemic, and the implications of the pandemic, the social implications, the tail end of the pandemic will be things that we'll be dealing with for a very long time as a country. So obviously, Kenny, over the last year, huge role to play in terms of the prevention of COVID and helping people recover from COVID and support people during this pandemic. And I think one of the things we know is that the pandemic has affected people differently. It's been very difficult for the whole country, but certain groups of people it has hit hardest. And if you think about the Marmot review and the recent report that he's done around sort of building back fair and COVID, you know, what we've seen is that it hasn't necessarily created health inequalities, but it's emphasized them, and it's really shone a spotlight. It's increased the health inequalities that people face. So we know some people were more likely to be negatively affected by COVID-19 as an illness. So people from particular BAME communities, people living in areas that were deprived, you know, were twice as likely to die from COVID than others. People with disability, more likely to be affected. People with learning disability, you know, we've got death rates for 18 to 34-year-olds, people with learning disabilities times higher than other parts of the population. So we know that it has affected people differently, and has really shone the light on the importance of tackling health inequalities and using the opportunities we have to tackle health inequalities. But with a pandemic, we often refer to different waves of a pandemic. You know, there's the immediate illness and infection, but then you start to have some of the other things that come from pandemic is some of the backlog of people who haven't been able to have the operations that were planned or whatever because the systems had to respond to other needs. You've got people who have long-term conditions because they might have been self-isolating, not moving, not looking after themselves during, you know, or being, you know, having other complications such as obesity or whatever. And then you've got the social impact of the pandemic. So the impact that the pandemic has on our economy. So, you know, lockdown has had a huge impact in terms of loneliness. You know, it's been really important to do to improve the health of our population. But huge surge in people experiencing loneliness and a lack of confidence in connecting with other people. We know that people have been affected in terms of employment and the effect that will have. And, you know, through the, it won't surprise people, through the media about the increase in domestic violence and other sort of social implications that people are living with during this time. So as an NHS, obviously we've been hugely busy with COVID, with vaccination, now on restoration, with helping people to get back to that, but also wanting to look to recovery, how we help the health system recover. So really looking at how we bake in some of the good learning that there's been through COVID, because I think what we've seen at a local level, and this will be my last thing, Kenny, on this, is the value of working in partnership with health, local authorities, public health, and voluntary sector partners and industries, everybody working together in their neighbourhoods and at a local level to be able to use everything we've got to be able to address the issues that our country's facing in terms of their health and well-being and helping us to recover from the last year. Now, personalised care, Kenny, you asked me about, that's one of the key themes. Personalised care is one of the key themes in the NHS, NHS's long-term plan. So this is the 5-year plan that sets out how it's going to transform the NHS. And one of the key themes in that was personalised care. It's one of the 5 key major changes that all health and care systems have to make over the next 5 years. So that's really, really important. So what it is, it's about helping people have more choice and control over how they receive their health care and how they get the support to live their lives their way. It's about helping people develop knowledge, skills and confidence to be able to look after their health, but also to achieve their potential and do the things that really matter to them. And it's about being more flexible with resources through things like personal health budgets. And it's about taking a much more holistic view of people's health. So looking at the biopsychosocial approach rather than a biomedical approach to be able to help people to improve their health and well-being. And at the core of it is a couple of phrases, one of which I would say is it's about what matters to me. So it's really understanding what a good quality of life is to the person and what matters to them. And also nothing about us without us. It's about how we co-produce the future and we co-produce people's support at a personal level with individuals themselves, because they are the experts in their own lives and in living their own lives. So major change for all health and care services. So really important for people to be aware of. 6 key elements. So your rights to choice, shared decision making. So making sure that people understand and are part of making decisions about their health care, that they fully understand the options and the risks and the implications of each of them and are part of making that decision with clinicians. Supported self-management, so health coaching and peer support, and making sure we look at how how people are doing in terms of knowledge, skills and confidence, and whether who needs more support because they don't have as much agency or confidence or knowledge to be able to look after their health and well-being, and being able to target that support appropriately. Social prescribing, which we'll talk more about in a minute, which is very much about solutions other than medicine, connecting people to community support. Personalised care and support planning. So really having a personalised care and support plan that starts with what matters to the person and identifies those outcomes with the individual. And then personal health budgets, which is how we can use health funding in a more flexible way to enable people to have greater choice and control over their health and support.
So there's multiple components to this, and yeah, as you said, we'll talk about social prescribing, dig deeper into that in a moment. But just a big thanks from all of us, I think, as well. By the sounds of it, you guys have had your challenges, so well done. So Grace,
just say a huge thanks also to people that have supported NHS staff during this period. I think it's been a particular, not just NHS staff, but all key workers, and I think that's hugely appreciated when industry finds ways to actually support the people delivering those roles to look after their own health and well-being.
Did you get invited to the Brit Awards last night?
No.
No. I'm not sure if anybody saw that. It's colourful affair, but we digress. Grace, what the current state of affairs for you at the moment, and what are you seeing with Exi, the engagement with your app, and tell us what's happening.
Yeah, for sure. And Nicola touched on a lot of the points there as well, because it overlaps significantly with, as she exactly mentioned, personalised care. Still looking at the guidelines, the long-term plan, and how does healthcare change beyond just medicine and beyond some of the traditional paths. So what we've been seeing so far is exactly what Nicola's talking about, and that seeing those things creep in. Some of it, unfortunately, is because it's forced in, the joys of not being able to physically see people face to face, the technology being that connector between people in clinic through to people at home, and still enabling that connection, as well as how do we get people to as you mentioned, personalize and support themselves, but also be able to personalize and support that data and what they're doing and that communication back to that care team so that they can have visibility on what they're doing as well. So what we found, and Nicola touched on it as well, so we've been working with a number of organizations across the NHS where we'll be providing Exi, the platform, in different contexts. And some of this is to the likes of, say, Active Oxfordshire, where likewise they want to support people in the community to get active, get moving, get healthy, and to help support that thread of data, but also making sure that they're completely, it's very important here, the difference of Exi from a typical fitness activity app in the space is it's looking at that personalized care and the long-term chronic conditions in particular. So the NICE guidelines, the ACSM guidelines, and all of the guidelines that are around how do we support the medicine, the evidence of the chronic conditions. And I say exercise is medicine. I suppose it's not a new term. We've all heard that term for years, and we know exercise is medicine and prevention is better than cure. But we can't lose the science. So what Exi is bringing all of that science for 23 conditions, what we focus on, all of that science of what is exercise for that person, for that condition, and layering it on top. Because unfortunately, as we know, lots of people have more than one condition, they've more than one risk factor. And again, as Nicola touched on as well, is their agency, their choice. Right, some people like to go for a walk, some people don't. Some people like to go for a swim, some people like to go to Zumba. Some people, and all of that. And we don't care in one way how people get active. It's more about let's get you active, let's help you to figure out and hopefully build confidence and connect with that. And I think that comes back to what we're talking about, which we'll get into more, Kenny, around the future, is joining the dots between all of these amazing facilities, the fitness industry, an example, and all of the non-fitness industry activities as well that are in parks and in playgrounds and in all of the centres and locations around the UK, and bringing that together and hopefully helping to give people the confidence to go, I can go to that class, even though I have multiple conditions and I'm on multiple medications, but I can take some of the personalisation here, some of the self-care, take care of myself and have the confidence to do that. While, and this is very important from the Exi side as well, as we're quite conscious of, it's a partnership. I think Nicola touched on it obviously as well, the partnership of the health and fitness professional supporting that individual and doing so, I won't say at an arm's length, but in a way that is driving self-care, but still support and accountability at the same time. So having that back-end platform, seeing that data, seeing how their mood, and we talk about mental health being a huge, issue and wave of the pandemic that we're in, looking at, are people, feeling confident? Is their mood improving or getting worse? And alongside that, is there metrics? So is their glucose numbers, variable? Are they changing? Are they going the right direction? Also, are their activity, but also their blood pressure numbers and all of the other metrics that we associate with different conditions, because obviously nothing works in isolation. And I think we're at the perfect storm, Kenny, is that's what we're seeing, is that perfect storm of, I suppose technology was forced in one way to some parts of healthcare, and we hope that in partnership, it doesn't, the value is seen and it doesn't disconnect just because we're back face to face, that the value is proven, the value of integration and kind of that hybrid is there, and it's evidence-based, and it's able to be confident around prescribing with technology, but making sure as well that we're taking care of the person in their community, giving them agency, but also making sure that they don't feel disconnected. They feel connected and potentially more connected, because there's potentially more data and there's more engagements, but they're quick snippet engagements more often, as opposed to, come on into the clinic and we'll see you in 6 weeks or 6 months time. So, and that's what we're seeing. We're absolutely seeing that in cardiac rehab for one. We're seeing it in, in weight management and other, so like the tier 4 weight management in Barts is one example that we're with. Portsmouth is a hospital around the cardiac rehab, but the gyms, we're seeing GP referral programs. Again, likewise, the gym is being closed. Lots of people, it hasn't reduced on the number of people needing the access GP referral program. So it's again working with the fitness industry and how do they do that remotely while supporting with the personal trainers on that engagement, be that face-to-face now that we're getting back into open centres. And look, I think we've moved the needle forward a long way, to be honest with you, around understanding that we all work together, we'll get there, right? And we'll get there better, and we'll get there with better health outcomes, hopefully, in a way that we are joined up. I think it's that perfect storm where technology supports all of the long-term care plans, all of the NICE guidelines, all WHO long-term guidelines. They're all the same, like nothing's changed there. And I suppose what I would see is like Exi isn't novel. All we're trying to do is bring all of that evidence that we've known for decades to life. And because of, we now have the technology at the place it's at, we have the ability to join the dots in a really powerful evidence-based way that connects people to people, but through the means of technology, to the means of do it at home with care, with evidence, but personalization. And I suppose this is where I think is the most important piece, is nobody's an expert in everything. We work with cardiologists who are saying loads of their patients have diabetes, for example, but they're not diabetes specialists. And likewise, they also have obesity potentially. And unfortunately now we're seeing a huge numbers of stress and anxiety and depressive symptoms, and they're not experts in that either. So it's what we're trying to do here is to join the dots and say, you don't need to be an expert in absolutely everything. So we let us help you in terms of exercise, and we just focus on the exercise piece with it. And we can feed through all the data points around glucose and cardiovascular disease and so on. But it's joining the dots of, let's get them active. If nothing else, we can join the dots and get active, because we know that works. We know it works, and we know it in combination with either the medication that they're working on, or in combination with the link workers working with the community programs and so on. It helps to kind of join the dots a bit in the middle, and that's what we're seeing. We're seeing that partnership model really forming, and that's part of what we've built as well, is making sure that the platform is integration is a key piece of it, and we can join the dots between people and people, with technology being a strong supportive medium, but still evidence-based.
Great need for it as well. You mentioned diabetes. I think there were shocking figures last week that was 5 million of us. And there's about 1 million people who have it and they don't know it. But we'll get on to a little bit about that in a second. I'd like to move on to around social prescribing specifically, if that's all right. But there's 2 questions in here. One is around funding from George. And I think that we'll come on to that, I think, down in the next section of solutions, because I've got some ideas on that, and so will Nick, I'm sure. And there's a second question, I think might be directed at you, Grace, about plans to export the services outside the UK. Now, I'm aware that you are currently outside the UK. Do you just want to briefly tell Joe what you're doing outside of the UK?
Yeah, for sure. So the platform itself is available pretty much in every country in English. We're not expanded yet to multiple languages. That's on our roadmap. We're currently just going through the CE marking for Europe and the UK CA marking as well. So we'll be ultimately a medical device by the end of this month. And then we'll be looking towards the FDA as well. And that we don't need to go through regulations because activity is well proven, right? And we're basing everything on the science. It's already there. But we do think it's going to help add value, I suppose, and help add reassurance to the likes of insurance companies, pharma companies, who we will and will be working with. But yes, we're currently already in the US and have some great conversations with some amazing, partner potentials over there as well, and with huge organizations. So if anyone is in different markets, happy to talk. We have plans for a few different markets in English for now, and then next year we'll translate to a number of languages to help us to grow in different areas. Unfortunately, Kenny, we have the same global problem, right? And the one good thing in this is the global solution is the same. So we're not changing the algorithm or the solution, really. We're just expanding out the evidence and expanding the languages to meet people where they're at, and hopefully talking the simples of language of let's get you active in order to manage or control or reduce or prevent.
Again, people, feel free to put your questions in the chat, and we'll try to address those. Let's talk about social prescribing specifically, because this is the session's theme. There's a variety of businesses on here. You will have a role to play in this, if not right now, but will be in the future. For instance, if you use the fitness and leisure sector and the exercise field as an example, it's currently an engine room keeping millions of people active per week without, and that's outside of incidental walking. That's without a strategy or governmental strategy. If we can you imagine what would happen if we had a real strategy behind that? So there's loads of societal value in that sector, that business. There's a backlog of people awaiting rehab. There's, I think, about 4.7 million now for routine operations, I believe. Nicola's nodding, so I'm glad I got that figure right. We've got some pressures. Social prescribing is one of the solutions. It's not the only, but social prescribing is big solution. Is a massive one because of these complex problems. Can you go into some detail a bit about, what exactly is social prescribing for people who don't know that on this panel or on this?
Sure, and if I sort of explain how it can help improve health and well-being, that's great. So Grace has mentioned the NHS long-term plan. I've mentioned that. So I think one of the things that I will just say about social prescribing before I go in and explain it is this is a core feature of the personalised care commitment within the long-term plan for the NHS. And so the long-term plan talks about rolling out social prescribing across England so that by 23-24, over 900,000 people can benefit from social prescribing. And in order to do that, the way that it's doing it, and one of the investments that the NHS is making, is to fund social prescribing link workers across primary care networks. So primary care networks obviously are the multidisciplinary teams that come together around GP practices, so it's your GPs, it's your nurses, it'll be the occupational therapists, the pharmacists, all of the team that comes together to help address the health and well-being of that local neighbourhood community of people. So social prescribing link workers are being embedded into primary care networks across the country. We had a target of 1,000 link workers in place by the end of March. We've exceeded that. We're currently looking at about 1,500 link workers across the country, with the intention that they build up social prescribing teams as part of those primary care networks to be able to respond to the needs of people locally. So social prescribing it enables people to connect with activities and community support that will support their health and well-being. So biomedical science absolutely has its place. We've got vaccines, all of those sorts of things, absolutely important, A&E, everything. But actually, the issues that we're facing are, as a country, and this is across the whole world, isn't it? Is that it's the wider social issues that affect our health and well-being that need to be addressed. So it's really looking at social prescribing link workers will spend time with an individual to really find out what matters to them. So it's really understanding what's working and not working in their life and their perspective. And then they help to connect people up to community support that will help to address that, their health and well-being. So the sorts of things that they might connect people to are practical and emotional support. So support that addresses social determinants of health. So poor housing, debt, unemployment, relationship issues, all of those, being a carer, all of those sorts of things that are social determinants of health. But they'll also connect people up to solutions other than medicine, where there's a non-medical solution that would be as good as or better or as well as what's the medical treatment or the pills or whatever that they're being offered. For example, exercise, nature, the arts. So they're there in a GP surgery. So we know that at least 20% of people that go to their GP don't go with a medical issue. They go with, they might be lonely, they might have some social issues that's causing anxiety, depression, and whatever. And this enables the GP and other members of the team to connect them to a link worker who's got more time than a GP to be able to sit over 4 to 6 sessions as an average to really understand what's the root causes and how to connect them up to things in the community that will improve their health and well-being. So the sorts of people that a link worker sees: people who have complex social needs, people who are lonely or isolated, people who have one or more long-term conditions, people who have mild to moderate mental health needs. That's the sort of thing. And it's very interesting that during the pandemic, we are seeing more and more social prescribing link workers for children and young people as well. So children and young people hugely affected by the pandemic and not being in school, not being with friends, and sort of seeing an increase obviously in mental health issues, children and young people. So that's why in a surgery it's really important to have a team of social prescribing link workers rather than just one of them. And now, Kenny, at this point, lots of referrals around digital poverty. And Grace, I'm just sort of thinking, it's so key here, isn't it, around unemployment, around people who need lifestyle advice because they've got long-term conditions and they've not been doing the exercise that can help them to maintain or improve their condition, homelessness, disabled people, children, young people, and people who have been experiencing grief. We've done a lot of people around bereavement, not being able to grieve in the ways that would help them, and connecting them up with the right support and advice.
Huge ambition, huge challenges. I always use the example when talking about social prescribing that if someone's boiler is not running, how can you help them with their long-term conditions? So that's where you guys, social prescribing comes into play, isn't it? Try to fix that, some basic Maslow hierarchy of needs. I think people, fix some of those needs, then you can probably push them toward maybe becoming.
And in order for it, and I think what we're doing, Kenny, that's I think really important is that obviously we're rolling out social prescribing link workers. We're looking at the training, development, support for them, helping primary care really understand how to use them properly. But the other part of that is, what does the community have? What's the assets in the local community that you can connect people up to? So really we're working with commissioners to help them to think about how they can start to bring people together to understand what's the needs of the local population, what's available within that population, and where are the gaps. That's not for health to fund all of those, because obviously every different department, every different part of the sector has a role to play. It's how can we bring people together and look at how we use statutory funding more effectively, but also how we can actually start to use charitable funding and corporate funding to be able to bring everything together. And I think that's what COVID has really enabled people to do at a local level, is start to have those partnership conversations and how they can work in partnership to be able to deliver stuff. And I think, when it's Mental Health Awareness Week, and the really important, and it's nature, that's the theme. And, what's really key, it's what Grace says, is, it's finding what matters to you, what interests you, what's your sense of purpose. So, for me, my exercise has been Nordic walking because I love the outdoors, so I think being able to build those partnerships locally is absolutely so key, and looking at how to form those strategic partnerships gives us a huge opportunity here.
Huge opportunity, and there's a need. Enter Grace and some of the uniqueness about EGSI is around the long-term conditions, I know, and you're doing some work around with clinical and academic institutions to show the impact of digitally prescribed exercise. And, can you talk to us a little bit about that, please?
Yeah, for sure. And I think just marrying what Nicola said there, digital literacy, I suppose, and digital poverty are two things we're quite conscious of. And I think we've all appreciated that inequality in healthcare, unfortunately, have gone hand in hand, for decades in pretty much every country in the world as well. And we're very conscious to that. And look, Exi was started by two physiotherapists who wanted to kind of just close the gap between the personal decisions they'd make on a one-to-one basis and expand that out. So we're very, very conscious of that and trying to not widen the gap, but close the gap. So if anyone's looked at, Exi itself, we've purposely gone in with, I suppose, a very affordable, with the idea of being one, and a very also limited what you need to get going. So all you need from our side is a smart device, right? Smartphone, right? Once you have that, you're kind of good to go. Now, the more you have, the more accuracy you have in terms of data, wearables, and so on. But if you have a glucose monitor, blood pressure, and all that data will feed in, and it'll get more and more intelligent. But the main thing is let's get you going. And what we want to do is allow clinicians to be able to say, let's get you started. Let's prescribe you exercise. And I think often, as we all know, clinicians have been for decades saying you need to get more active. One of the gaps that we see is people don't know what that means. So unless it's for you, it's 5 minutes, because you've had a cardiac event and so on. And for you, it's 5 minutes, build it up gradually, because the perception often is, oh, I need to get active, I need to get into a fitness class, I need to get sweaty, it's an hour long, and people don't know what that actually means. So it's trying to get them into a journey of every activity counts, and it's all day and it's every day. And it's not just the fitness class, high intensity, or that you have to go for a run and run marathons. And because that's what we're seeing sometimes, people don't know that 5 minutes, 10 minutes, and building it up slowly, gradually in bite-sized chunks is sufficient and is health enhancing. And that's what we're hoping to do, as well as to give people a bit of confidence today, going, all you need to do today is 10 minutes, next week it's 15, the week after it's 20, and build it up to the guidelines, and give them that confidence, because there's fantastic opportunities in the community. And that's exactly what we want to be able to do with the link workers, is support that people don't know sometimes. I know Nicola knows this more than anybody, that they don't know what's available to them on the doorstep, and hence why that link worker has some time to explain it, talk to it, and figure out the connection. And where Exi comes in is the science around the frequency, intensity, and time. So it's reducing it down to, even if you do go to that class, that walk, the activity, here's the intensity zone that you need to be in for safety for your conditions. So don't worry about, sweating it out and going hard for 6 minutes. That's not what Exi is about. We're the opposite end of, it's building it up gradually, slowly, bite-sized chunks, and working with all of the part of the industry to kind of feed that through, that it can connect with any activity. And that's really important. And look, we've seen it as high as 93% uptake when it's being prescribed. So when your doctor says to you, not just go get active, which they've been saying for decades, and they say, actually, here's your prescription, the uptake is nearly at 100%, which is just crazy. So you can all appreciate, your doctor says do something, when it's tangibly do something, you're more than likely going to do it. So, and that's where we're hoping to be, that, again, that connection between, I've been prescribed it, and I've been prescribed a prescription that I can see for 12 weeks, and not just 12 weeks, but for long term. And I'm able to do that, and do it in conjunction with my doctor or my cardiologist or my link worker or my personal trainer, or whatever part of the health and fitness and world that the person wants to engage in, because it all doesn't matter, right? If it's a walk, Nordic walking is fantastic, fantastic. And actually walking, we see, is our biggest activity. You're right, the nature is just as powerful drug in itself. So let's get people out there. And if it is just for 5 minutes or 10 minutes, 15 minutes, and that's what the person should be doing based upon all the evidence, well, that's perfect. Let's reward them for that. And I think, Kenny, we talked about, rewarding activities and using better funding, or using funding better sometimes. And I think we do need to really think of how do we incentivize people to move as well, because the reality, I suppose, it's often hard when you're in an NHS that is fantastic, but there's no financial impact, right, of you not getting active, right? There's no financial impact of you not managing your long-term condition. So we got to find those triggers to go, what's motivating me? Because it's not financial, and it might not be tangible. Like reducing my glucose numbers might not be tangible for somebody. Feeling better, my mood, that might not be tangible. So I think we just need to get creative around how do we incentivize and be tangible with people that activity is powerful, and it's not just let's kind of the looseness of it that we've had before, but prescription. Here's exactly what you need because you have risk factors and you have conditions, and it's not a nice to do, it's a need to do, and it's need to do now, and let's get you moving.
Yeah. And with the growing prioritization of how personal fitness and well-being supports overall health, there's opportunities for industry to design and deliver services like you're doing to appeal to, you know, your non-traditional customers if you're a business watching. You know, I use the fitness industry as an example. You know, 66% of cancer prehab occurs in our spaces. Now, I think the gentleman who produced that statistic is on the audience here today. You know, in 2012, Royal College of Physicians released a report, Exercise for Life. It talked about emphasizing the contribution of exercise to prevent disease. 2015 was the Exercise Miracle Cure. And then last month, NICE, the National Institute for Clinical Excellence, and for those who are not in the UK, it's the Guidance and Advice Information for Professionals, you know, talked about how doctors should be advising prescribe exercise rather than pills. So there's real opportunities for business to be able to support the NHS in those ways. You know, Nick, do you want to talk a little bit about what's happening with the not just the fitness and leisure industry upcoming, but maybe DEFRA or things that are doing with the Arts Council England as solutions? Maybe we can start talking about some solutions here.
Some solutions, and I think, you know, sort of what are some of the things that we can do, and the leisure industry and fitness industry can do, it would be really helpful. So I think one of the things that we are really noticing is the power of partnerships. And so we've got a cross-government social prescribing, green social prescribing program that's DEFRA-led, working over the next couple of years with many different government departments. And we are working with Sports England and others on that piece of work. But that's 7 sites across the country that are really looking to see how they can expand green social prescribing across their integrated care footprints. So to make sure that there's more activities to be able to connect people to, but also that the providers have the knowledge, skills and confidence to support people. These programs are particularly focused on people with mental health needs, so the prevention and early intervention of mental health issues, but also being able to support people who have severe and enduring mental health needs to live their best lives and to improve their health and well-being. And you know, that they're really, really interesting, because I think they're looking at how strategically they bring all of those green partners together to be able to understand what the offer is, looking at the needs of the population and therefore what type of providers they need in the market, and then really looking at how they can increase the offer. So, I mean, I'm just thinking about Humber Coast and Vale, you know, working with organisations like York Bike Bells that offer cake and confidence to start cycling, but just helping to get people interested in cycling and being able to connect up socially. Some really lovely stuff about nature and nearby walks and rides, where they actually organise walking activities to help people know their local area, identify some of the key trees and landmarks within their local area. But I think it's that bit about really focusing on what matters to people, working in partnership and being able to extend that offer.
Yeah.
But I think, you know, Kenny, we see some really interesting things, I think, of how the fitness industry is working with social prescribing. And I was thinking about some of the Sport England pilots. So Pennine and Lancashire, you know, some really good things about where they've located link workers, some of the link workers into the leisure centres to be able to help make that relationship and connection, and really sort of see how the link between the GP surgery and the leisure centre and the social prescriber can really be good. Others looking at actual activities, physical activities within the GP surgery. I think, as you said, Grace, when your GP tells you to do something, people tend to listen. So it gets huge validity of recognition when you've got those sorts of exercise activities happening, particularly for people that may lack knowledge, skills and confidence to go to some of the bigger community groups, sort of almost having some safe places to start to get confident with exercise and being with other people. And then other places where I was thinking about Exeter and Cranbrook in Devon, where they've really been looking at the successful platform Wellbeing Exeter, and looking at how they can make sure all the leisure offers are part of that platform, because we don't just want social prescribing link workers to connect people up to exercise, arts and nature. We want anybody in the system to be able to signpost people. The link workers, I think, can really focus on people who really are struggling with some of those wider issues and need more support to engage, some more help around knowledge, skills and confidence.
We've got a couple of questions coming in, but just to clarify what Nick was saying, the fitness industry in the UK has offered 500,000 hours to the NHS come autumn to be part of that pathway to increase accessibility to people who do need that. And so it's via a healthcare pathway. And from that, we are going to look at building a business case as well to look at what might be sustainable, what works. Nick's going to want to know what works in the industry. So that's an example of how industry is, helping the social prescribing pathway. Just before we go to the questions, Grace, did you want to add anything to that at the moment around some solutions before we go into a couple of questions from George and Daniela at the moment that I want to go to?
No, I think Nicola's hitting the nail on the head there. There's so much that's already happening, and there's so much integration and partnership. I think we just have a huge opportunity to, and like I said this before, around exponentially expanding this out and making sure we achieve on it. We've talked about it, and we know the values, we know the reasons, we know the why, we know the science. We're at a perfect storm, I think, to fundamentally shift the curve here. So yeah, I'm just really excited to hopefully work with Nicola more as well around doing it and succeeding. And hopefully we're here in 12 months' time with success stories that are absolutely powerful and world changing.
Exponentially instead of incrementally, was it you phrased that before when I was speaking to you?
Yeah. I'm big into leapfrogging. Let's not do things in small. Let's think big, start small, but let's think big because we have the opportunity to achieve big. And I'm very conscious of, like, as I said, 93% of people picking up prescription because a doctor told them to. That's ridiculously larger than what it is when it's more generic around, go get active, go get fit, go find a trainer, that kind of stuff. So like that is just a leap. That's a massive leap forward, and adherence is higher, completion is higher, and so on. And I think that potentially could be that exponential jump forward, which then makes sure that people are properly using link workers and properly using the personal trainers that are out there, properly using the entire industry that's there to support keeping you active. But I think that maybe that kick is that prescription, right? It's that you have to do it. It's not a nice to do, it's a need to do, and let's go. Let's go now.
I'd like to just come to George. George, if you want to ask maybe your both questions, and we can see if we can pick those off, and then I'd like to answer Daniela's, and there's a couple more coming in now.
Yeah, my second one wasn't so much a question, but through our funding, we're looking to scale up social entrepreneurs, but that links to my first question, really, Nicola, and possibly also Grace on your own experience, which is there's a big thirst for social entrepreneurs to actually go to the next level and spread their services, but they need more than just link workers. And so I was really interested in how you see the funding for social prescribing sort of developing. Particularly, I suppose, in my own program, I've been reluctant to get entangled with integrated care because it's been so slow to actually deliver funding solutions that businesses can actually grapple with. Joe from Aetna might actually have more to say on that sort of thing. But so that was my question about, are we actually seeing real funding come into the front line for social prescribing beyond link workers?
So do you want me to say a little bit, Kenny, just about what we're trying to do? So we absolutely know, George, that there is something about social enterprises. So we are really looking at voluntary sector organisations, social enterprises, faith organisations, really needing to look at that. And I'm not sure whether you're aware of the National Academy of Social Prescribing, which has been established, and they are particularly looking at how can we develop that sustainable offer for social prescribing activities and have an offer targeted at that group. But I think what is really important to do is look at what we've got to be able to do what's in our gift at NHS England, is really looking at how we can start to bring commissioners together at that place level and at a neighbourhood level to understand the needs of their population, understand what's available, and use the public money as sensibly as possible, but also looking at those opportunities to bring the other sources of funding together. So all the different sources of funding that come together, and the role of DCMS and others in being able to do that. So we're really looking at how we've been looking at micro grants at a very local level for very small organisations, small community groups. We've been looking at how personal health budgets might come in the future. At the moment, they're mainly for people with more complex needs, but where are there small amounts of money that can be attached to social prescribing to help people access activities in the future? But this is the sustainable future of the activities is definitely high on our list, and something that we're looking at how we can develop that over the next period.
And just to add to that, back to your question as well, George, around the fundings from our side. So we're working within the funding models that are already there for now. So we're tapping into the weight management national framework, the diabetes prevention national framework, that would be a mission. There's lots of different funding models already that, when you come from an angle of we want to reduce inequality and not become a premium expensive product, that we actually can fit in nicely to the existing funding model. That's our first kind of protocol there. And we'll be a significant part of that hopefully in the next few months as well, and we'll start to see all the evaluations and the effectiveness there. There is different funding models. I think Nicola touched on that there. There's a number of them right now. Obviously, it's hard to understand all of them, so we're still learning. And I won't lie to you, from a startup perspective, it's hard to see that list of funding streams that exist and to see which ones you can complement and work with. We're also engaged with a number of research partners and research areas as well, and to look at the future of what do we look at, and the likes of research for grants for how do we use data more effectively. I think the world of data has existed for a long time. We've had lots of data, but we haven't been using it really, and we haven't been using it effectively to help that end person, right? I think there's lots of data in the world, and tech is a victim as well as a culprit in this. Trying to use tech for the business purpose, but that's not what we started the business for. Like everyone, you think in health, and we're all the same, right? We all started in this journey for the purposes of actually driving change in the world. And I think if we can properly analyze and use the data, and we have the models now, we have the functionalities, we have the AI and the machine learnings and all of that, and use that to give it back to that end user, right? Give it back to that person to go, here's what's happening. When you do go for a walk, you have less pain. When you do take your medication on time, it's more effective, and giving that knowledge back to the person so they feel empowered to continue on this journey, and also to better understand their condition, to better understand what this data actually means, because it's complicated, right? Especially if they're on multiple medications, multiple conditions, multiple, I suppose, tested kits and blood results and everything like that. So we want to be able to try to use that data to tweak and personalize the prescription more, in order to give them, again, more precision for their exercise, but also giving them more knowledge. So self-care, because at the end of the day, we're never going to have enough clinicians and people around the world to motivate every single person. We have to work with the individual feeling empowered, and we hope that again we can do that, where we can use that data and drive it. And we've engaged with yourselves, George, as well, to help support how do we tap into some of that funding that you guys provide in order to prove it, right, and to help build out the AI and machine learning and make sure that we're doing it with all of the evidence and science that exists in the world, and also building the new science. I think we need more science to build.
Yeah.
Great. Sorry to interrupt.
Yes, absolutely.
There's a common person that we work with that usually says that. I'm very conscious of time. I just wanted to pick off one two questions. I will answer one about from Professor Professor Caparozzi in Rome, who's asking about the competencies around fitness professionals. So it's a really good question. I'd like to address that. Hi, Daniela. And then whilst I do that, Nick, you probably are better for this one. Whilst I say that, if you can think about the evaluation of success of social prescribing. So Daniela, where there's no clinical prescription requirements or no red flags for reasons to be modified, then this should not create any challenges for a qualified fitness professional. This could be as simple as a level 2 gym instructor to help with healthcare needs. Someone to, it could be simple as someone to show someone around the gym, or a basic gym induction. For any more personalized programming, a standard level 3 PT would suffice. And then SimSpa are working on a long-term conditions practitioner that will look at specialized fitness professionals to help with health conditions. So really important question. And we are preparing our workforce at the moment to receive an influx of people with long-term conditions. And of course, people like Nicola and George and others are going to be wondering, are we ready for that? So, you know, the answer is yes. Where there's no major clinical exercise requirements and no red flags, there's no reason why people can't be coming in to the exercise workforce of about 400,000 people to help with healthcare. Daniela, does that answer your question? Great.
Thank you.
Kenny,
Thank you for selecting my question. Generally, yes, even though, you know, the definition of the European qualification framework level is a very complicated issue, and of course, but I was more referring to the real skills and competences. So, you know, basic knowledge, specialized knowledge, communication skills, management skills, these kind of skills. We are providing education, and as a provider of education, I'm really interested in understanding what the job market, the fitness market is looking for, especially when talking, when referring to health enhancing physical activity. You know, we are designing our profile of our graduates, postgraduates, or whatever. We can also talk about level 2, 3, 4, 5. This is up to you. But then the issue is what this professional shall be able to do, not only in specialized area, but also in general skills.
Definitely.
But thank you for answering. Thanks.
You're welcome. You're very welcome.
Very interesting session. I was very interested.
Oh,
Thanks.
good. And then I've got your details, Daniela. So I would like to talk more about that. But, you know, healthcare practitioners are having difficulty as well with the communications and to be able to actually look at the benefits of physical activity. So, you know, we've got the same challenges in fitness with the fitness professionals, and, you know, behavior change. How many of them know about behavior change? It is part of their training for some practitioners. So we are going to be doing a inventory, a consultation around social prescribing this summer, and we'll find out more. Quickly, Nick.
Very good. I was just thinking about how do you skill up the sector? How do you help the sector have person-centered conversations and that behavioural motivational interviewing and that sort of stuff? Very good. So evaluation. So just a couple of things to say. We have developed a common outcomes framework, which is part of our reference guide at NHS England for organisations implementing social prescribing. And that really looks at outcomes for individuals, and it looks at outcomes for the health system, and it looks at outcomes for the local community. So that's something that's worth people having a look at. We've also been looking from a supported self-management perspective. We obviously, normally in social prescribing, people are often using things like ONS4, or they're using WebWebs, or they're using outcome stars, or they're using a whole range of things. We recommend ONS4 for everyone. They might be using patient activation measure, where people have long-term conditions. We're recently refreshing and developing a supported self-management framework that will provide a number of measures that are suggested for supported self-management, and will include some social prescribing aspects within that. And that is going out for procurement soon, and there will be some money to systems, health systems, to help them to access that. But have a look at the Common Outcomes Framework. The other thing is that there is a national evaluation of social prescribing services that has just been commissioned, so that's very exciting. That's going to be happening over the next couple of years, and we've also been exploring minimum data sets and doing some piloting around minimum data sets, so capturing who gets referred to social prescribing and what social prescribers connect them to. So
thank you very much, Nick. And I see Josh appearing here, so I'm sorry about that. You know, I hate cutting people off. Hi, Josh.
Hi, Kenny. Thanks so much to Kenny, to Nick, and to Grace. Comments coming in saying thank you. Really interesting session. I'm just very conscious of time because we do have another interactive roundtable with our colleagues at UKRI starting very shortly. So firstly, just want to say again, huge thank you for you all to joining and to continue for the conversation today. Please do keep the conversation going through the platform as well. I hope you all had a chance to use it. You can add people, connect with people, set up one-to-one meetings and chats. But for now, we do have our next session looking at an insight into the UKRI Healthy Aging competition starting in, starting now really. So if you log back out and then go back into the platform and log into the next session, hope to see as many of you there as possible. And thanks for joining us today.